Welcome to our NCLEX review class. Today we study how to master basic care and comfort for NCLEX.
I'm Dr. Julia, reaching out to you from Ontario, Canada. It's very important that we master basic care and comfort because it's an area that you can really do well and it can really boost your performance on the NCLEX.
So let's get this information in. Basic care and comfort is a top area of failure on the NCLEX because many candidates do not pay much attention to it. And there are some other top areas of failure on the NCLEX, which includes safety and infection control and reduction of risk potential, pharmacology, psychiatry. So these are all areas you have to do well and master it in depth. Okay, so that's why we have psychiatry crash course, we have pharmacology crash course. If you still need to polish up in those areas, do reach out and I'll share more details with you. So I always bring this sheet and it has basic care and comfort here. This is the CPR, the report that candidates receive when they do not pass the NCLEX. And see, we have basic care and comfort here, and you're expected to do well in this area. Basic care and comfort is about providing comfort to clients and assistance in the performance of activities of daily living. So that tells us that it's a very important area because you're dealing with the clients every day. So here, basic care and comfort covering about 6 to 12% of the NCLEX test. You would want to master basic care and comfort, you can learn. But this session will help us have an overview and get the basic tips for basic care and comfort. Let's dive right into it. So as I stated earlier, 6 to 12% of NCLEX are an exam for basic care and comfort. And it's all about providing comfort and assistance in the performance of activities of daily living while ensuring safety, dignity, and independence. So these are the 9 major areas. So do well to write it in your notebook so that as you study, you check it and you know that you are covering basic care and comfort. So assistive devices is a must know. Elimination needs, we will dive deeper into it and you understand it. Mobility, immobility, and positioning. Nutrition and oral hydration. Personal hygiene and grooming. Rest and sleep. Comfort and pain management. The non-pharmacological methods. And then skin integrity and pressure injury prevention. And last but not least, palliative and end of life care. Very important. So let's dive into it. We want to be able to give you an overview. So we'll be running through all of the areas and you would have to do well and go and do a deep dive into all the topics for basic care and comfort. And if you would want a crash course, we would arrange that. So for assistive devices, canes, crutches, walkers, wheelchairs, mechanical lifts, gait belts, and then fall prevention, prosthetics, splints and braces, adaptive utensils and dressing aids, hearing aids, glasses, dentures. So you have a client with dentures, what are you supposed to do? If that client is going for a surgery, what are you supposed to do? You can have questions on all of that. Then body mechanics and ergonomics. So that's for assistive devices. So I'm going to give you some highlights on this topic. You must know how the clients will move around with a cane. We have a lecture, a deep dive on that. Cane, that the client's supposed to hold the cane on the stronger side, like how the client will move the cane, move the weaker leg, and then the strong leg comes. So you have to know all of these motions. And one mnemonic that helps candidates to remember this is cane opposite affected leg. So normally the client will hold the cane on the opposite side. So if the pain or the injury is on the right leg, the client will be holding the cane on the left. And then how will the client walk with the cane when going up and down the stairs? So these are stuff that you should know. So client will go up with the good leg, and then down will come down with the bad leg. We have a deep dive on this, and as you are studying, look out for the pictures. We usually attach, today I did not attach the pictures, but when you see the pictures, it helps you to remember that the client is going up with the good leg and then comes down with the bad. And walker, how would the client move around with the walker? So the client is holding on to the walker. The client will move the walker first, then the affected leg will go before the unaffected leg. So you have to know the motions so you can practice it yourself. The client is holding on to the walker will move, then the affected leg, then the unaffected leg will follow. Okay. And elbows have to, so the client is holding on to the walker, so the elbows will be flexed at 15 to 30 degrees. And the client is not supposed to pull on the walker to stand. They can get injured. So these are all important stuff for basic care and comfort. So what about crutches? 2 to 3 finger widths between the axilla and the crutch top. And the weight on the crutch, it should be on the hands, not on the axilla, because if the weight is on the axilla, the client can have nerve injury, the axillary nerve moving all around, and the client can have injury to the nerve. Okay. And even with using crutches, we have different types of gaits. The 2-point gait, 3-point, 4-point, swing to and then swing through. And you have to find a way to master them so that you will not get confused when you have questions on crutches. So the crash course will be needed. Yes, mechanical lift, all under basic and comfort, that when we have to mechanically lift a client, we need 2 trained caregivers, not just everyone around, not just any helping hand, 2 trained caregivers. And we have to lock the wheels first. Okay, you have to lock the wheels first. And if client has any hearing aids, we have to turn off before cleaning the hearing aids. The hearing aids have to be stored in a labeled container. If your client has dentures, how do you deal with it? They are stored in lukewarm water, not hot water. Then ergonomics, bend knees, not the back. You keep load close to the body. So if you have to pick a heavy object, you bend on the knees to pick it, not bending on your back. And then you have to keep the load close to your body as much as possible, because you want to release the pressure of your spine. So it's important to watch out for this trap. You don't fall for it. When it comes to assistive devices, never delegate the use of assistive devices to UAP. You know, we've done delegation. Do not delegate the use of assistive devices to UAP for newly fitted or post-op clients, okay? The RN has to assess safety and understanding first. Remember, if everything is new and needs assessment, RN has to handle that. Do not hand that over, okay? So let's look at, we are done with assistive devices, and the basic care and comfort is an overview. Do well to read the details. Let's look at elimination needs. So first, under elimination needs, urinary elimination. So catheter care, if you have a client with a catheter, keep the bag below the bladder. I think we know this. Empty the bag every 8 hours. And then for perineal care, clean front to back daily and after bowel movement. So it should be front to back, not from back to front, to avoid any infections. Then prevent UTI. You should be preventing UTI in dealing with clients who have catheter and all of that. We do well to encourage fluids, 2 to 3 liters per day. Clients should avoid bubble baths, and then they should wear cotton underwears. So they sound basic, but we have to know this and help our clients. And then there is a need to assess for urinary retention. A bladder scan is needed if client is not voiding after 6 hours. Toileting schedules and bladder retraining after catheter removal. So if a client has been on catheter and it's been removed, you have to know what to do. Toileting schedules and then retraining the bladder. If we use the condom catheter, we should know that we leave it 1 inch space at the tip. And then for these kind of catheters, we have to remove it daily. So this is for urinary elimination. So we move to bowel elimination. So constipation prevention. This is very key for your clients. You see, they are basic, but you must know it to be a safe nurse. Give that client fiber, so 3 Fs, fiber, fluids, and then fitness. Fiber, fluids, and fitness. If we have to do enema, what do you have to do? You put the client in the left SEMS position, and we insert the enema syringe 3 to 4 inches. And if the client is cramping, you have to stop it. What about ostomy care? The client has had maybe bowel resection, and then the bowel has been pulled out through the skin, and then there is a bag. How are you going to care for this opening, this new opening into the skin, which has the bowel? The stoma has to be pink and moist and empty when it is 1/3 full. And then the pouch attached has to be changed every 3 to 5 days. Okay, change it every 3 to 5 days. Diarrhea. Monitor for dehydration. If a client has diarrhea, this is what you're supposed to do. And bowel elimination. Monitor for dehydration, avoid milk and then caffeine. What about digital impaction removal? You have a client who has had chronic constipation and has fecal impaction. You have to do digital impaction removal. For this one, you remember this. You need provider order, okay? Provider order is required. Provider order is required. What about bowel obstruction? Client will have distension, absent bowel sounds. Immediately you pick up this, you have to report immediately. Bowel obstruction has to be reported immediately. So let's look at these mnemonics that will guide us. The 3 Fs. So fluids, fiber, then fitness. This helps with regular bowel movements. Okay. And anytime that you are in doubt, get them out. Client should ambulate, client should hydrate, and this will help with free bowels. Great. All right, let's go on. So we're now looking at, we are still on basic and comfort. We are looking at mobility, immobility, and position. This topic must know. We should know about position. We should know about mobility needs of our clients. So if we have a client who is not able to move, what are we supposed to do with regards to repositioning? Reposition every 2 hours. That's the minimum, okay? Because we want to prevent any pressure ulcers. And then with body alignment, we have to always make sure that we maintain the head, spine, hips. They have to be aligned because we do not want to cause any injury. Whenever you have to move your patient, to position your patient, watch out for body alignment. Let's look at these devices. It's very important that we pay close attention to these devices. So for trochanter rolls, it helps to prevent external hip rotation. So we put that roll, so it's in a form of like a roll to put in the area of the trochanter, and it prevents external hip rotation. We have footboards. If we can have a client and you are anticipating foot drop, we use that to prevent foot drop, okay? And then abduction wedge, post hip replacement. So these are all important devices under basic care. So range of motion. So when you see active range of motion, know that is the patient moving. And if it's passive, it's the nurse helping the client to move. So why is like movement so important? Because it helps to prevent all of these complications, DVT. And then with DVT, if we want to really help with preventing it, apart from the movement, we can have to put the client on compression stockings, okay? Then also static hypotension, dangle legs, pneumonia, we do incentive spirometry, and then deep breathing, constipation, hydration, top, and then encourage movement. So you have a client on the ward, has constipation. So even before we prescribe anything, as a safe nurse, you have to make sure there's adequate hydration and then movement. Clients should move. Then for pressure ulcers, reposition and be inspecting the pressure areas. So this is a very important slide. I remember I spoke about it the last time. Positioning is a must know. So know about the Fowler positioning, high Fowler, semi-Fowler, side lying, so like lateral position, Sims position, that's the position for enema administration, and prone position, Trendelenburg and lithotomy. You should know the cases and when do we do like put the client in this kind of position. Know this. Let me run through it. So Fowler promotes breathing and eating. High Fowler, aspiration prevention. And when you are feeding, semi-Fowler, tube feeding. Side lying, that is lateral when you want to drain secretions and do oral care. Sims for enema administration. And then prone, if you have a client with ARDS, if you want to improve oxygenation, prone positioning really helps. Then Trendelenburg, so hypotension or central line insertion. And then, yes, the lithotomy position, that is the childbirth position and for pelvic examinations, okay? So we move into nutrition and oral hydration. So many people do not do well in this area because it looks like it's kind of basic, but there are some details that you must know. So if you don't pay close attention to them and you do not read into detail, you realize that you were not prepared for those kind of basic care and comfort questions. So if for nutrition and oral hydration, assess swallowing before feeding, especially you have a client with stroke. You have a client with stroke. So make sure that you assess before any feeding because you want to make sure you do not cause any aspiration. Okay. So position upright 90 degrees, remain upright 30 to 45 minutes after a meal. Okay. Remain upright. Clients should remain upright 30 to 45 minutes post-meal. Use thickened liquids, okay, if ordered, and avoid straws in dysphagia. For engine tubes and peg feeds, this is very important. Before you put in any meal, you have to verify the placement. You have to be sure that the engine tube is in the stomach. So we aspirate and check pH, or we take an X-ray which shows that the tip of the tube is in the stomach. We can check the residual and then we hold if the residual is more than 500 ml. Flush 30 ml before and then after you have given medications through the engine tube. So this is all under basic care and comfort, and you should read all these details. So diet types. So diet, very important. So much to learn under diet. So look at clear liquid diet, full liquid, mechanical soft diet, diabetic diet, cardiac diet, renal diet. And how do you check for hydration? Urine output more than 30 ml per hour. Client should have moist mucous membrane. So you are checking the mucous membranes and then the urine output. So for safe feeding, remember this. Client should be sitting upright. Assess whether the client can swallow. Feed slowly. Evaluate. Okay, and then if you are feeding, you have to make sure that you elevate the head of the bed. You have to educate your client and always remember to document. Do not forget, always document. So personal hygiene and grooming is all part of basic care and comfort. You should know about bathing. It sounds interesting, but you should know it for the exam. Bathing, the water, the temperature, 100 to 110 degree Fahrenheit, and you should know how to do the bathing. We're moving from the cleanest areas to the dirtiest areas. We don't go clean the bum before we come up. So we do well to clean the cleaner areas before we move to the dirtiest areas. For unconscious clients, do oral care, side lying. Client should be lying on the side. And then if there's a suction available, we have to suction. Perineal care, I mentioned it front to back. For males, you have to retract the foreskin, clean, and then replace. Foot care, no soaking for diabetics. Then we have to file the nails straight across. So all these details are important. Shaving, so this is under personal hygiene and grooming. Shaving, electrical razor for anticoagulated patients. So you may have a clinical scenario and we're telling you that this client is on anticoagulant. It means that the client can bleach, and then it's under personal grooming, and you're supposed to choose what you will use for the shaving. And you should remember this. Electric razor. So when it comes to the hair and the scalp, we have to inspect for lice and then any wounds. Hearing aids and dentures, remember they have to be stored properly, and then check the battery and then make sure that you fit it. Maintain privacy and cultural sensitivity. So when you are dealing with the personal grooming of a client, based on where they are coming from, you have to do well. For everybody, you are maintaining privacy, but also do well to know the cultural context from which those clients are coming from. For some cultures, if it's maybe it's a male, yeah, he would prefer that it's a male nurse taking care of him. So you always would want to know some of these culturally sensitive areas is very important. So when it comes to delegation, UAP may face the client and perform routine hygiene. But remember, it is the RN who will assess the skin. Okay. For assessments, always remember it's RN. So rest and sleep, important points to note. These are highlights, so please do well to do a deep dive into these topics. And if you want a crash course, let us know so we can organize it for you. Promote rest. So cluster care, that means that if you have about 5 things to do for the client and they can all be done together, you get it done at a go. Instead of coming in, then 10 minutes later, you come in again, it does not help with the client's sleep. So cluster care, minimize noise and light, and then maintain routine. Encourage relaxation. So whichever way the client uses to relax. So music, reading, prayer, avoid caffeine, nicotine, and then alcohol before bed. So this will be like pointers for your client's teaching. If it's a case scenario and client has issues with sleeping, you should remember this. It's under basic care and comfort. So support comfortable room temperature, like 18 to 22 degrees Celsius. Manage sleep disorders. So if client has sleep apnea, we have to help them with the CPAP, and they should avoid sedatives. Insomnia. If client has insomnia, you have to limit naps and promote daily activity. So remember this for sleep, rest, mnemonic. We have to reduce stimulation. If you want our client to have a good sleep, reduce stimulation. Environment should be calm, set a bedtime, and then turn off screens. Very, very important. Let's now dive into comfort and pain management, the non-pharmacological methods. It's under basic care and comfort. Heat therapy, it increases circulation, but avoid on any new injury or areas with poor sensation. Heat therapy. What about cold therapy? Cold therapy will come in handy if you want to reduce some swelling or reduce pain. And remember, limit it to just 20 to 30 minutes. Okay, 20 to 30 minutes. Massage, reposition, guided imagery, distraction, relaxation, and music therapy. So these are all ways to give your clients some comfort and help manage their pain without giving drugs. So we are massaging, we are repositioning, guided imaging, distraction, helping them relax, music therapy. So what about post-op? If you want to find ways to help your client to be comfortable and manage their pain, splint incision during coughing or deep breathing, because when they are coughing or breathing deep, they may have some pain. So we splint the incision. Comfort care agents like oral hygiene, clean linens, like make sure that their beddings, everything is like very clean, and give them the right positioning. It will make them comfortable. So for all of these non-pharmacological methods, it's like it's an independent nurse in action. And that's why you must know it, so that it's a basic care and comfort that you can give to your clients, and you must know it. So remember, repositioning before repetition of any medications. So we always have to do the non-pharmacological stuff first before you even think of medications. Let's look at this important point: skin integrity and pressure injury prevention. So if you have a client who is not moving, there's a lot of moisture around, like that client is malnourished, there is the likelihood that they can come with skin integrity issues or have pressure sores. So we have to assess the risk routinely. You should not just leave it and realize that, whoa, the client is developing pressure ulcers. So read this into detail, the grading scheme, which will help to assess the risk routinely. And how would we prevent? How would we prevent? So we have to turn our client every 2 hours, use pressure relieving surfaces, so like heel protectors, air mattress, maintain hydration and protein, albumin more than 3.5, keep skin clean and dry. So it's important to know about the stages, okay, of the bed sores, the pressure sores, and look at images so that it helps to stick. Stage 1 to stage 4. Look at it, look at images, it helps it to stick. Okay. So yes, remember this: turning every 2 hours, use support, relieve pressure, adequate nutrition. This is a trap. If you see it in options, do not take it that we do not massage. Do not massage the red or the tender areas. Do not choose that option of massaging the red or tender areas. let's look at this. We are finishing up. We are almost through. Palliative and end-of-life care. So for palliative and end-of-life care, your focus should be giving comfort to the client, dignity, and then supporting the family, because everything has been done and we realize that not much can be done to save the client's life. So we focus so much on giving the client as much comfort as possible, the dignity of the client, and also supporting the family. We manage the pain, oral dryness, any difficulty in breathing, giving oxygen, use of fan or repositioning. Avoid invasive interventions, vitals, and then drawing a lot of blood for labs and all of that. And you have to provide privacy, spiritual support, and then cultural respect. Allow family the time and the present, because the family feels that they're going to lose their loved one. So give them all the time with the client. And this is also under post-mortem care. Remove tubes if is allowed. So client is gone and you are preparing for post-mortem. Removing all the tubes if allowed. Close eyes, mouth, clean body. Label and document per the policy of your facility. And then the ethical notes. Follow the advanced directives and DNR orders. Prioritize comfort over cure. And then remember this. Comfort, so this is for palliative and then end-of-life care. Prioritize comfort. So teaching acceptance, and then respect, and then empathy for your client. So awesome. We have been able to cover the overview for basic care and comfort. So I guess you have noted all the important areas you have to master to be able to ace this topic. You see, it's basic. So if you really pay close attention to it and look at the necessary details, you can get a lot of marks here. So do not sit on this. Go do a deep dive into basic care and comfort. I'm going to post the link here. If you want to register for a crash course, you can join us and we will do that. So we always welcome you. Join us inside of MedCognito, where we focus on your mindset, mastery, give you content, only what is needed, so you do not waste time. And we also give you strategy to be able to prepare adequately to ace the NCLEX on your first attempt. So if you have any inquiries, if you have any questions, feel free to message us here. Take a screenshot, save the contact, MedCognito support, and you can always reach us and I will respond to you.